Welcome back to our channel. Today, we're diving into an important topic for all healthcare professionals: Abdominal Aortic Aneurysm, or AAA. This video will provide a comprehensive overview based on the latest updates from StatPearls. An abdominal aortic aneurysm is a localized enlargement of the abdominal aorta, exceeding the normal diameter by more than 50%. This condition is critical due to the risk of rupture, which can be life-threatening. Epidemiology. AAA predominantly affects older adults, especially males over the age of 65. The prevalence in men is around 5 to 7%, while it is lower in women, approximately 1 to 2%. Risk factors. Key risk factors include age, over 65 years, gender, male smoking. Major modifiable risk factor: hypertension, family history, atherosclerosis, pathophysiology. AAA develops due to a complex interplay of genetic, environmental, and inflammatory factors. The degradation of the extracellular matrix and smooth muscle cell apoptosis weaken the aortic wall, leading to dilation. Clinical features. Many AAAs are asymptomatic and are often discovered incidentally. When symptoms do occur, they may include abdominal or back pain, a pulsatile abdominal mass. In cases of rupture, patients present with severe pain, hypotension, and shock, requiring immediate medical attention. Visuals, diagnostic imaging techniques. Diagnosis: screening with abdominal ultrasound is recommended for high-risk populations. Other diagnostic tools include CT scan, provides detailed anatomy, and is essential for surgical planning. MRI, an alternative in patients who cannot undergo CT. Visuals, surgical procedures. Management: treatment strategies depend on the size and growth rate of the aneurysm. Surveillance. For small AAAs, 3 to 4, 5 cm, regular monitoring with ultrasound is advised. Surgical intervention, indicated for AAAs larger than 5.5 cm, or those growing rapidly. Options include endovascular aneurysm repair, EVR, a minimally invasive procedure. Open surgical repair, a more invasive approach, typically used when EVR is not feasible. Visuals, postoperative care and follow-up. Postoperative care. Post-surgery, patients require regular follow-up to monitor for complications such as endoleaks in EVAR patients and graft-related issues in open repair cases. Lifestyle and patient education, encouraging smoking cessation, controlling blood pressure, and managing cholesterol are crucial. Educating patients about the signs of AAA rupture and the importance of regular follow-up cannot be overstressed. That wraps up our overview of abdominal aortic aneurysm. For more detailed information, check out the article linked in the description. Don't forget to like, subscribe, and hit the bell icon for more updates on medical topics. Stay informed and stay safe. Thank you for watching.